Hi, Tom Robson from Essex Private Doctors. I wanted to introduce our new heart health check. This is particularly important as we want to emphasise the importance of getting things checked out and reducing risk early. We know that every 5 minutes, someone's admitted in the UK with a heart attack to hospital. Often people don't get symptoms, have no awareness of this prior to symptoms coming on. Therefore, it's really important to assess risk early, and once we've assessed that and identified any problems, to treat or modify these risk factors to reduce risk going forward. So what does our health check involve? First of all, it involves a comprehensive cardiac history, finding out about any potential symptoms, finding out family history of heart disease, looking at potential conditions like diabetes, hypertension, cholesterol that people might have that we can look to assess and optimize treatment. Looking at lifestyle, which includes diet, smoking, alcohol, exercise, and looking at family history to see whether people are more at risk. So those are the things we do history-wise. We then move on to an examination. Examination will involve a cardiovascular examination, listening to the heart, checking the blood pressure, checking the pulses both in the legs, in the neck to see if there are any problems there. Listening to the lungs, is there any evidence of any fluid on the lungs or any problems with the heart manifesting within the lungs? We then move on to urine tests, dipstick in the urine. Is there any evidence of narrowing of the arteries affecting the kidneys? So we check for protein or blood in the kidneys. We check an ECG, looking for irregular heart rhythms, looking for evidence of ischemia, so reduced blood flow to the heart that's evident on the ECG. Any evidence of hypertrophy, so enlargement of the heart, can be seen on an ECG. And then finally, following that, we'll be doing some blood tests, a panel of blood tests, kidney function, liver function, diabetes, check your cholesterol levels. But on top of that, the cholesterol levels, we have a much more detailed breakdown that's able to be offered, including tests that aren't available on the NHS. These tests include apoprotein B. This is to be your bad cholesterol, your LDL cholesterol. This is a transport protein that takes the bad cholesterol around, depositing in the blood vessels, contributing to atherosclerotic plaques. We measure the apoprotein A1 as well. This is good cholesterol. A really important test that measures your genetic propensity towards heart disease. A high level of this puts people at higher risk. But the advantage is if we know this, we can treat this risk accordingly and treat more aggressively with people with risk factors, blood pressure, raised cholesterol, and we can treat to lower target levels, particularly of cholesterol, to reduce people's risk. We'd also test a CRP level and also an LPPLA2 test, both of which measure inflammation, and inflammation can be associated with atherosclerosis or risk of atherosclerosis. So these tests may be raised even if there's no other evidence of raised cholesterol, for example. Once we've got all these tests together, we've built up this picture of your cardiovascular health, we can then give you a risk score of your risk of cardiovascular disease over the next 10 years, potentially over your lifetime. We can then go through this in a follow-up 15-minute appointment and decide what the next steps may be, whether this is looking at lifestyle modification, treatment of your blood pressure, cholesterol levels that are thrown up by these tests, and potentially using the services that we have available to us, like our dietitian, possibly arranging further tests, thinking about, if necessary, involving a cardiology team locally. And once we've got this all together, we can get a plan that's personalised for you to work out how we can help improve your heart health, how we can reduce your risk. Is this lifestyle modification? Is there any need for any further treatment to bring things down? And give you the confidence that you're where you want to be. And if there's anything that's been changed, help you make those changes to reduce your risk going forward in the future.